It's Saturday night and let's talk the walk. I'm Sarah Wong. This week we'll discuss the Omicron Covid variant with Dr. Benjamin Cowling, public health professor at the University of Hong Kong. Doctor, welcome back to Talk the Walk. Thank you for your time and my deepest appreciation as usual. Now, what we've known so far is that, what we've heard rather, is that researchers from South Africa, where Omicron was first reported, said it may cause milder infections. But the World Health Organization said, yes, it is spreading faster, but mainly among young people at the beginning, and urged the world to stay vigilant and not to rush to judgment. Can you help us cut through the noise and tell us what we've known so far for sure about Omicron?
The picture is still emerging. What we've seen so far in South Africa is that infections are milder indeed than they were previously with Delta or other variants. But that's in the context of South Africa having a large number of infections in the past 18 months, the past 2 years, particularly most recently with the Delta epidemic. And so it seems that most people in South Africa already have a reasonable level of immunity, if not from vaccination, which the coverage is a relatively low level, more likely from natural infection. And so we know if you get an infection, then the next time round, if you get infected again, it's going to be a bit milder. In other parts of the world, we're still waiting for better quality data on severity. It does seem as though infections on average are a little bit milder, but what we're going to see most likely is even if infections are somewhat milder on average, let's say half as serious on average, but if there were twice as many infections, then you're back to the same place. You've got just as many severe cases. And what we're seeing in terms of the rapid transmission of Omicron in Europe, the US and elsewhere, is that the case numbers may go well beyond double, triple, quadruple what they have been before. And so we could be seeing a situation where there are many, many more cases of this slightly milder infection, and as a consequence, having a lot more severe cases than we've had in recent months, unfortunately.
Let's talk about immunity first. We've heard that Omicron, it's easier to evade natural immunity that's provided by human body because it shares a common string of the gene, for example, that's what I heard, from the virus that's causing the common cold. Now, how much does that reshape our understanding of the coronavirus? And is a booster necessary if the primary goal is to prevent severe disease and hospitalization?
We can think of the immunity that we get against COVID as actually two shields, an inner shield and an outer shield. And so the outer shield are the antibodies which protect us from even getting infected. And if the virus manages to slip through that outer shield and we do get infected, we still have this inner defense, this inner shield with the T cells and the cellular immunity, which reduces our chance of severe infection. Now, all the vaccines that we use for COVID in Hong Kong and elsewhere in the world will give us protection of both types, some protection against infection and also some protection against severe disease. And where Omicron's causing a particular issue is the virus is very easily able to get through that outer shield that we've built up either through vaccination or in some people from natural infection. And so Omicron can escape those antibodies. It can infect people more easily than the other variants, but we've still got the inner defense of the protection against severe disease. So that the summary is vaccines are still working. They're still protecting against severe disease, but they may not be as good at preventing infection with Omicron compared to how good they've been with some previous variants and strains.
Yeah, on that note, that we heard that recent studies found that both doses of the Sinovac and Sinopharm vaccines cannot offer strong enough protection against Omicron, and even the Pfizer-BioNTech's two-dose regimen is down to 30% effectiveness in preventing Omicron infections. Now, first of all, have these studies provided an accurate assessment of the human immune system against the virus, or is rather a narrow point of the immunity?
Well, let's be very clear that we're talking about in the antibodies, we're talking about the outer shield that I mentioned. So that's the loss of protection against infection. But the vaccines, whether it's Sinovac, Sinopharm, or BioNTech or other vaccines, will still have provided that inner shield, that defense against severe infection. So even if there's less protection against getting infected, we'll still benefit from the protection against severe disease. But as a consequence, people who've had vaccines maybe won't be as well protected against Omicron as they have been against the other variants, because Omicron can slip through that first line of defense. And then you still have the second line, but you don't have both lines of defense, if you see what I mean. So we'd expect some benefit from the vaccines, but looking forwards, I hope that we will see more people getting their third dose. And then maybe next year, sometime towards the middle of next year, maybe in Hong Kong, we'll be able to have booster doses for Omicron specifically. By then, it may be our fourth dose, not our third dose.
So help me evaluate the situation here. We are in 2021, at the end of 2021 now, 2 years into the pandemic, with a significant portion of the population vaccinated with double dose and even some countries 3 doses. But with the new emergence of Omicron, it's like you said, can easily evade some of the immunity provided by human defenses and vaccines. So does it present a bigger threat, given that even that people are vaccinated, more people are vaccinated today compared when the pandemic began 2 years ago, and even when Delta emerged around a year ago?
I think the hope with vaccines is that once vaccines are widely available, we won't need those other public health measures that have been used around the world in the last 2 years. I'm talking about social distancing measures, even going as far as total lockdowns, but below that, school closures, workplace closures, cancellation of large gatherings, everybody's wearing masks, all those other things. So I think we had this hope that once vaccines are widely available, we don't need those other measures anymore, because those other measures are what's been stopping COVID from spreading too much in the past 2 years. But it turns out that this winter in the Northern Hemisphere most likely will need a combination. We'll have the protection from vaccines, which is good, but it's not perfect. And there may also be a need for some public health measures to slow down transmission. But looking forwards, after the next 6 months, after this winter in the Northern Hemisphere, I would imagine most parts of the world will be able to go back to normal, and we'll be able to just rely on vaccines. It's unlikely that we'll need many more public health measures, but this Omicron wave is a major challenge first to get through.
And talking about social distancing measures, a lot of European governments, including Austria, Germany, and even Britain right now, are pondering rolling out this vaccine passport system. Do you think vaccine passports will be effective in slowing the spread of the virus? And will that work in Hong Kong?
I think vaccine passports are one of the ways to encourage vaccine uptake. So what you have to look at is what's the current level of vaccine uptake, and if you want to get it even higher, then you can go for schemes like vaccine passports, or even in Austria and Germany, I heard they're thinking about mandating vaccination. Obviously, if the vaccine coverage is already very high, you may not need to do that because you already have enough vaccination coverage. And remember, at the same time, for this winter in Europe and in some other parts of the world, we may still need public health measures on top of whatever vaccination coverage we achieve. So I can imagine some governments are thinking if they've got 80% vaccine coverage, they're going to need to bring back public health measures anyway. They could combine that with vaccine passports in some way so they can have some level of social distancing, also get the vaccine coverage a bit higher. That may be the best of both worlds. But in the longer term, I hope that we won't see too much more use of vaccine passports because COVID won't pose so much of a threat anymore.
Now, Hong Kong's health officials and experts insisted that Omicron has not reached the community yet, and their main priority right now is to prevent it from coming into Hong Kong. And under these new circumstances, some experts think that there are loopholes in our current quarantine exemption system. One, for example, for cargo aircrew. Do you think there are any loopholes right now that we need to fix?
Well, firstly, I think we recognize that Omicron does pose a major threat to Hong Kong, as did the other variants like the Delta variant most recently with COVID. And the virus has found ways into our community in the past, and in the future, it will most likely find ways into the community again. The only real way to guarantee that you wouldn't have the virus coming into Hong Kong in the coming months would be to shut the city completely off from the rest of the world. But in reality, that's not feasible. We can't shut the city off from the rest of the world. We need cargo coming in. We need container ships coming in. We need deliveries of goods and other services. And hopefully, in due course, we'll have an open boundary with the mainland. And so we'll have people coming in and out of Hong Kong every day. With that in mind, it's going to be impossible to completely prevent the virus from finding its way into the city sooner or later. We hope that it's later, and we hope that by reducing the risk, maybe by having some special observation of cargo pilots who are essential workers, other air crew, people that work at the container terminal, people that work at the border. If we can monitor them more carefully, then we can pick up cases more quickly, like with the very recent case with a pilot that had Omicron. If we test these people every day, if we keep a close eye on them, then hopefully we can pick up an infection before it has a chance to spread. But I think it's unrealistic to imagine that we can keep the virus out of our community in the long term. It will find its way in sooner or later. And that's what the experience in the mainland tells us as well. The mainland are trying just as hard as us to keep the virus out. But from time to time, there are outbreaks. The virus does find a way somehow to get in.
The mainland obviously also face another challenge is they have much more people than we do. And it's such a vast country with multiple fronts with the outside world. But talking about quarantine and talking about keeping the virus out, do you think that regular mass testing, not mass testing, but regular testings like once a day, specifically focused on high-risk people such as air crew cargo air crew members, is a more effective way in preventing the import of Omicron cases and coronavirus cases than lengthy, prolonged isolation, such as in Penny's Bay Quarantine Center?
I think there will be a better balance, because I doubt that it would be sustainable to ask all of our pilots to just stay at the airport for the coming 6 months, the coming 12 months, and not see their families and not be able to ever get out of quarantine. Because remember, they'll fly somewhere, they come back, and then they have to stay quarantined for a little bit, and then they fly again and back again, and they get away and back again. And then at the end of that cycle, they then have to be monitored for a while. And if that monitoring is still in the airport in Penny's Bay, I think it's going to be very difficult to keep the cargo planes flying, to keep air crew interested in working in Hong Kong, when of course there are many jobs for people with these skills elsewhere in the world. So I think daily testing would probably be a better way to manage the risk. We can't ever get the risk all the way down to zero, but having something like daily testing of people that are doing home quarantine would make a lot of sense as a risk minimization measure.
All right, let's pick it up after the break. Dr. Wong will be back in a moment. Stay with us.